Hello, so welcome to Maternity Action's webinar on the COVID jab and its effects on pregnancy, maternity and fertility. I'm Aisha Mohsen, a trustee of Maternity Action. We're very happy to be working with the Mayor of London, Office of Health Improvement and Disparities, the Association of Directors of Public Health and NHS England London region to bring this event to you today. Before we get started, there are just a few housekeeping issues. We are recording this session and are planning to make it available on our website. We are planning to finish on time at 2, and we welcome people to use the chat function. However, if you are asking the panel a question, please use the Q&A function. There's so much information and misinformation around about the COVID jabs, particularly when it comes to pregnancy and fertility. So today's event is an opportunity to hear the latest advice from medical experts and to ask any questions you have. We want this to be an informal session where you can ask about whatever your concerns may be. We have 2 medical experts with us today, Nina Khazazadeh, Deputy Regional Chief Midwife for London, and Dr. Ogi Elozu, GP Partner of Brunswick Park Medical Practice and Clinical Advisor of COVID Vaccination Programme, NHS London. We're going to start with a short outline from Ogi, and then we'll move directly into the Q&A. And just a reminder, if you do want to ask questions to the panel, please put them in the Q&A function. Please don't raise your hand or put your question in the chat. You will need to put it in the Q&A function for us to see it. So I'd just like to now introduce you to Dr. Ogi Elozu.
Hello everyone, thank you for joining this afternoon, this lunchtime. My name is Ogi Elozu, as has already been said, and I'm pleased to be here for another Maternity in Action webinar. So we know now we've been offering vaccination in pregnancy since last April. It was initially when we started the COVID vaccination program in December 2020, we asked the question, are you pregnant? Are you planning to get pregnant? And we didn't vaccinate you at that point. And the only reason for that was we didn't include pregnant women in the trials. So we always take extra caution in this group. Whereas with emerging evidence that has now shown that COVID infection itself there's more risk of severe consequences for women who are pregnant, especially in the last trimester, and emerging real world data, especially at the States at that time, but increasingly from us in the UK, that the vaccine is safe and is effective in pregnant women. The firm recommendation is now to please proceed and get your COVID vaccination in pregnancy. So we recommend that you can get that vaccination at any point in pregnancy, and we're also recommending the booster dose as well. So pregnant women were included at the clinically at risk group by the JVCI in December for that purpose. We have been vaccinating lots of women across the country, and there's about 50%, I believe, in London, the rates of pregnant women who are vaccinated. So we really want to get that number up, because we've seen from, again, real world data in hospital that women admitted to ITU, women who are admitted to hospital, the serious consequences of not being vaccinated can mean quite severe infection, and that's a poor outcome for mum and baby, and we really want to try to prevent that when possible. I'm also here to plug the flu vaccine, and to normalize the fact that we have been vaccinating pregnant women for generations. It's something we've done for a while. So we offer the flu vaccine as GPs. We do this every year, the seasonal flu vaccine. That's still very much offered to all pregnant women, and we're still very much encouraging people to take that offer up. We also offer the whooping cough vaccine to pregnant women. Again, that's more about protecting the baby in the first 2 months of life, but it's just to show that vaccination in pregnancy is something we do, something that is safe, and something that's effective. And it wouldn't have been authorized if it hadn't been shown to do this. And we know that the benefits far outweigh any risks of any potential complications and side effects. I'm going to stop talking because the main aim of this event is to answer your questions and have a bit more of an interactive session. Thank you for having me.
Okay, I'm just going to start off by asking some questions that we received via email, and then I'll go to the actions questions that we've got in our Q&A box. First of all, what are the risks for catching COVID at each trimester stage of pregnancy, even if you have been vaccinated, and particularly the third trimester, which I understand is highest risk for you and your baby? And then linked to this, is there any evidence that indicates that you should take precautions even if vaccinated when there's a community case, when the community case levels of COVID are high?
Do you want me to get, yeah?
Do you want to start and I can add, yeah?
Yeah, okay, so I can start. So in terms of the risk of infection from COVID infection itself, at the moment, the prevalence rates are still quite high, even though we feel like in London, especially, we may have gone past the peak a little bit, because the rates of the prevalence are still very high. So the risk of catching COVID is as anyone else that's non-pregnant. Pregnant women tend to have a slightly lower immunity, so may be more prone to pick up things, but the risk is as the general population in that sense. We know if you're vaccinated, the risk is lower. So vaccination does protect you against infection. It doesn't eliminate that risk. There are lots of people on my list of my positive results that I file every day that have been triple vaccinated and are still getting infected. But we know that the infection is mild in those groups. They're not having severe complications. They're not being admitted to hospital. It's a heavy cold a lot of the time. So it doesn't eliminate your risk of infection, especially with the Omicron, but it reduces that risk. So everything we're doing, washing hands, social distancing, PPE masks, vaccination is all about reducing our risk of infection and transmission. So a pregnant woman is as much at risk, or maybe even slightly more, because pregnancy is a slightly immunocompromised state of contracting the virus, but we know that vaccination can reduce that risk.
Do you want to add anything else to that, Nina, or shall I go to
I think Ogie just explained it really well. The only thing to say that 2/3 of pregnant women who have COVID-19 don't have any symptoms, as Ogie said, it's like a mild cold and flu. So it's important that if any of the pregnant and birthing women people feel that they have those symptoms and are not sure what they may be, to seek help. And the only difference is that if a pregnant woman on a birthing person gets COVID-19, they will become severely unwell. And that's why it is even more important for them to have the vaccination.
There was a second bit to your question that I may not have covered.
It was basically whether people should still take precautions, even if they've been vaccinated, and when the community case levels are high.
Yeah, definitely. I would definitely recommend. I'm still, we're still wearing masks, washing hands, social distancing where appropriate, especially in enclosed spaces, ventilation. I would say we have all these different tools in our toolkit. It's about reducing risk. Vaccine is our most powerful weapon, but all of those things are really important. So especially because we are still in the pandemic, it's not over, despite what, some things may say. The case rates are really high. So you want to reduce that risk all the way down. Remember, it's the first time we've been in a pandemic, the first time we've had such a massive vaccination campaign. So vaccines have really been tested. We don't see polio in the rates, or measles or tetanus or any of the other infectious diseases that we vaccinate against in such high rates, because vaccination's been around for a while and we're not in a pandemic with those infectious diseases. So really important to still do those other public health measures. And it protects against other respiratory viruses, flus around, RSV in children. We know that it has helped mitigate against some of those that we see as well.
The next question is, I was double jabbed with Pfizer before my pregnancy. The first jab caused changes to my period. My cycle became shorter, the periods came earlier. In light of this, how can you be sure that the booster in pregnancy won't affect my baby?
Do you want me to? I can start and I'll go if you. I think it's true that these vaccines are new, and we need to acknowledge them. And there aren't any studies yet to show the long-term impact of them. But what's important to remember, the vaccine is not live, it's not a live vaccine. And as such, we don't anticipate, or we haven't seen any evidence from the studies that have been done around the world to show that there will be any negative impact on the babies.
Yeah, and I'll just add to that about the period. I think there was something about periods there in that question.
Yeah.
So this has been looked into because there has been women reported changes to their cycle after vaccination, and it has been looked into. There's an immunologist looking into it. I believe the Royal College of Obstetricians and Gynecologists have ongoing studies. But what we've seen so far is that the changes are short-lived. It will settle after 1 or 2 cycles, and there is no evidence of longer term impact on fertility. So women have been tracked real world, especially in the US, from people who didn't realize they were pregnant, people trying to be pregnant, to look at conception rates, look at birth rates, look at pregnancy outcomes. And there is no difference in people who are women who are vaccinated. There's no evidence at the moment of increased adverse effect on fertility, on the pregnancy itself, and on the outcome, and on baby itself. So like Nina said, these vaccines are not live. There's no feasible way that it can cross the placenta, the actual vaccine itself. What may cross the placenta are antibodies that we think may offer protection to babies in the same way we give whooping cough, because the idea of vaccinating mum with whooping cough are so those antibodies cross the placenta and protect baby, especially in those 2 months of life before baby gets their own jabs. So that's the precedent, as it were. And we have been following, those studies are ongoing in terms of, there's a V-Safe register in the States, and our public health agency, or the UK Security Health Agency, are following through with those studies. There was one published in, just check, last year, I just saw that, data published in November that provided additional evidence of good birth outcomes for women who were vaccinated in the earlier part of last year. So between January and August, they looked at birth rates and showed that vaccination is safe and effective, and those pregnancies had similar outcomes to other groups.
Is there any research on the long-term effects of similar vaccinations in pregnancy in terms of the outcomes as the child grows up, given that there's no data on the actual COVID vaccines?
So specific to other vaccines we've given in pregnancy, so for instance, we don't give live vaccines. We've given the flu vaccine for years and years. I don't have to hand exactly when we started doing that, but I've been a GP for almost 10 years and it's been part of my normal practice. And it's been going on way before that. The whooping cough, I believe, was introduced a few years ago because of the observation that more babies were becoming unwell in those first 2 months of life with pertussis or whooping cough, which is a very severe infection that can cause severe complications or even death. So that was introduced and has been shown to be safe and protective, because the idea is about reducing the risk from these infectious diseases that can cause complications and a problem.
If I may just add to that, the whole idea of flu vaccination is to provide a passive immunity to the baby, as Oggy said, to protect them during those early weeks in life. And there is evidence to say that in mothers who have had the flu vaccine, it does reduce the risk of having a baby early by 60 to 70%, and also reduces the risk of having a baby who's smaller for the gestational age. So they are actually very beneficial for the baby during pregnancy as well as after birth.
Yeah, just to say, my oldest boy is 7, and I remember having the whooping cough and the flu vaccine with him, and then having it again this time around with this little one. So yeah, it was just part of this is to reduce the risks and keep your baby safe, in the first few months of his life. So yeah.
Would that be helpful? Sorry, Aisha, if we just, because there are 3 vaccinations that you have during pregnancy, just to kind of reiterate the timing in which you can have them, because I can understand it can be quite confusing. So with the flu vaccine, you can have it any time during pregnancy. The times that you generally is relevant is around September and March because of the seasonal flus. Around the whooping cough and the pertussis, you can have it generally after 16 weeks of pregnancy, but most mothers have it after 20 weeks gestation after they had the scan. And with the COVID, you can have it any time. And bearing in mind that we would recommend the 2 vaccine and the booster vaccine, the earlier you have it, the more protection you get, because one single dose on its own is not going to be sufficient to give you the kind of the cover that you need.
The next question is, does the vaccine cross the placenta at 20 to 22 weeks? It might be helpful to, because I didn't really understand the significance of that. So I don't know if you could just, when you're answering, just explain why that might be important, or why people might wonder, like, why that might be an issue. Thank you. I don't know who wants to go first.
Happy to. So the vaccines that are recommended in pregnancies are the mRNA vaccines. So currently that's the Pfizer or the Moderna vaccine. And the reason for this is that we've seen more women globally vaccinated with those vaccines, because that's what's predominantly used in the US. So some women have had the AstraZeneca vaccine, and the AstraZeneca is a modified adenovirus vaccine, so slightly different formulation, but the same target is the spike protein on the coronavirus. So the idea with the mRNA vaccines is that it sends a message to your cells to make this spike protein, which then your antibodies are produced to then recognize it if it was to come across coronavirus infection itself, and then can neutralize it a lot quicker. So the mRNA itself is a message to your cells. So once it's deposited and it does its job, it's dissolved, it doesn't go anywhere. So there's no plausible biological way by which that can cross the placenta physically. What may cross the placenta, as I mentioned, are the antibodies, your body. So all a vaccine does is stimulate your natural immune response. We all have an immune system. The idea is that it sees an infection, it sees an enemy, it mounts a response against it. So all the vaccine's doing is facilitating and augmenting that and enabling that to be specific across certain targets. In this case, the spike protein on the coronavirus. So once you form those antibodies, some of those antibodies may cross the placenta, and potentially it has been seen in breast milk and in baby itself. We don't know for sure if it fully protects baby, but we know that the breastfeeding and the placenta and that whole thing is really beneficial for baby, especially in those early months, until baby can be vaccinated and baby starts to formulate its own immune defenses. So the vaccine itself does not cross the placenta. So whether you're 20, 10 weeks, 33 weeks, that's why the recommendation is you can have that vaccine at any point of pregnancy.
Nina, did you want to add anything?
No, I think Oggy covered it absolutely great. So that's fine. Thank you.
What protection does the mother have with the first 2 jabs if she's had the jabs 6 months ago?
Good and common question at the moment in light of the emerging variant of Omicron that we had just before the Christmas period. So we know that it's a pandemic and things have been moving so quickly. So the initial vaccines were formed against like what we call the wild type, the initial Wuhan that was discovered, Remember back, we're coming to 2 years since we first locked down, but discovered late 2019, early 2020. And they were really effective against that in the trials. Then obviously we went on to have Delta emerge, and that became the predominant variant here. And the vaccines were still judged to be protective enough against Delta, but it was really important to get as many people covered as possible. And we know 2 vaccines were better than 1. Then we had Omicron emerge, and we know it's massively more transmissible. So many people can be infected and will pick it up. And the vaccines are still effective enough against them. So the type of stats I'm talking about, we were hearing statistics like 96% effective against that wild type, dropping down to maybe about 75%. But that's with the booster, because we saw the JVCI looked at, especially over the summer, saw that the antibody response waned after 6 months, especially against Omicron and other variants that may emerge. So that's why they recommended the booster campaign in September last year, which we started in earnest, and it's still ongoing. So at first it was 6 months after your second dose, and then with the emerging picture of Omicron, they reduced that down to you can get that 3 months after your second dose. So we believe that the best protection against Omicron is having those 3 doses. whether future programs will adapt the vaccine, because every year we have a new flu vaccine that's sent to us. It's not the same one because it's adapted and adjusted accordingly to the flu that's circulating in that particular season. So one thing about viruses is that they always change. That's in their nature. It's part of what they do. They mutate, they vary. So it's a known fact we will see new variants. The question is, are the vaccines we have enough protection, or do we need to adjust them accordingly? So the decision was made, we can still stick with the vaccine we've had, but we need the booster. And the booster, once you have the 3, is thought to offer around about the 75% protection. But then think about how many people we're vaccinating. Think about how many case numbers we're seeing, 200,000. So even with a 75% rate, that's still 25% of a lot of people that may still be infected. But you have to ask yourself, what is that infection? And like I said, that infection is much milder. So what we're saying is that the vaccination, the 3 doses, will protect you against severe disease. That evidence and data is clear and really apparent for all of us to see in the healthcare, working in the healthcare sector.
There was another question which Nina has sort of answered earlier about the timing of the vaccines, but there was just a last bit that asked whether taking the COVID vaccine was more effective if it was done in a particular trimester.
I think because we're recommending the 2 doses and a booster, the earlier you can get it, you have a higher chance of have a higher protection against it, particularly as the Omicron we know is more effective if you have the booster. And I think that's quite important to have it as soon as possible. And even if you're planning a pregnancy, is a good time to have it. So as we have already mentioned, it doesn't affect fertility and it doesn't affect you becoming pregnant. So do you consider having it early, because you have to have a bit of a time in between each vaccination, and given that the pregnancy is only 9 months, then if you have it too late, you won't get the full effect and the benefit of the cover that the 2 doses and the booster will give you.
It might be a good time to reiterate the timings because it has got lost with all the different information. So first, you get your first dose, then the second dose is now 8 weeks after your first dose. And then the booster can be 3 months after your second dose.
Okay, I'm just going to go to questions in the Q&A. So just going to the top. What studies have been done on fertility having had the vaccine? I know you sort of covered it, Ogi, but just again, because it's more specifically just about...
Yeah, it's a good question. I saw that and I was just popping on the British Fertility Society website because I think they're the main ones that will be looking into it. I'm sure there's so many studies, I mean, the plethora of information going on. So I've not come across a very specific one and I will look for one, but I know that they're tracking women. So that V-Safe register are tracking women throughout, you know, and asking the question of when they got vaccinated, trying to conceive, you know, so fertility centers will be involved as well. And the recommendation from all of them is get your vaccine as soon as you can, even if you're trying to conceive. So it's an ongoing moving picture, but the real world data we're looking at has not shown any effect on fertility thus far.
This is another question which you've sort of covered, Nina, but I'm just going to go through it again because it's quite specific. Is there any evidence that if a mother's had the COVID vaccine during pregnancy, some antibodies can be passed on to the baby? I think you covered this as well, actually, Ogi.
Yeah, Ogi covered it. Maybe we haven't had any studies that I'm aware of. I don't know, Ogi, if you have heard of anybody that actually shows any. And in fact, we know that it doesn't, what's important is that the COVID itself, the COVID infection doesn't cross the placenta, which means that the baby, from the studies that we have at present, doesn't get the COVID vaccine. Now, there are some babies who may have contracted the COVID infection after birth, but we don't really know yet. There is no study to suggest that that was because of the mother.
Yeah, there was a small study from, I believe it was from Israel, data from Israel I saw some months ago, that did see antibodies in baby from vaccinated women, babies born to vaccinated women. So it was a very small study, and obviously they were going to follow up. I've not seen any follow-up since, but it's something I'm going to look out for. So thank you for your question.
There's a question. I got my first jab before I got pregnant, got my second when I was 8 weeks pregnant. I'm thinking about getting the booster. However, I'm 33 weeks pregnant now. My question is it still safe at this stage? And if I develop fever and generally just feel ill, is it going to affect my baby? Is he going to feel ill?
I think this is a really good question, and the important message is the vaccination or the booster doesn't cause any problem, and you can have it at any stage during pregnancy, and we would actually recommend it because we know that the studies from the number of women who have been admitted to the hospital during pregnancy with COVID shows that 1 in 100 pregnant women who'd been admitted tested positive for COVID infection, and 1 out of 10 of the women requiring intensive care in pregnancy had issues with having higher chance of stillbirth, so that's twice the chance. And the same applies to having a baby that's premature or born early. So the risks are quite severe, and you can absolutely have it. And we know actually that 96% of mothers who went into the intensive care requiring support were not vaccinated. So any time during pregnancy, you should consider, if you're considering it, it's safe to have it.
Also, to the part about is the baby going to feel it? I don't know if we have any information about that.
No.
I don't think there's any evidence the baby will feel anything like that in utero. So women can be ill in pregnancy. It happens like anything, And just remember, after vaccination, some people do feel a little bit unwell, a bit run down, a little bit of a sore arm, a bit feverish, achy. That lasts a day or two. You can take simple paracetamol if you wish, or just rest up and drink plenty of fluids. That's completely fine. But baby is not affected by vaccination, or you being unwell or slightly unwell after vaccination, I should say.
Is there any evidence that having had COVID previously has a positive impact on the likelihood of catching the virus? This lady or this person contracted COVID at around 10 weeks gestation, and they're just wondering about the impact of this. They've had the first 2 vaccines pre-pregnancy, and they're a little bit worried about having the booster now that they're pregnant.
Shouldn't be any effect as far as I know. So there's no evidence. So COVID, people are picking up COVID. So natural immunity versus vaccine-mediated immunity has been one of the big questions of the current climate. But it's fine to, even if you've had COVID, we say wait 28 days and then you can proceed and have the COVID vaccination, even after you've had actual COVID. So there shouldn't be any impact on having the vaccination. So you will be eligible for your booster now you're pregnant, even though you had COVID, if that makes sense. So let me just read the question again. Is there any evidence that having had COVID previously has a positive impact on the likelihood of catching the virus? So anything that boosts your immunity may lower your risk, but we believe that the vaccine-mediated immunity is longer lasting and prolonged and more effective at protecting you from future infections of COVID.
Having heard some, this person said that they've heard some doctors talking about different kinds of antibodies. What's the difference between neutralizing and non-neutralizing antibodies? And how do injections affect the body's ability to produce non-specific antibodies?
Good question, and deep immunology there. You're gonna test me now. I mean, I can't say I'm not an immunologist, so I can't. I'll have to go into some more detail and maybe provide some more detail later on. But generally speaking, there is, like you said, there's the more specific, there's your B cells, your T cells, and these are the antibodies that are formed after vaccination or after you're exposed to an infection. And some then hide away and then re-emerge if you're exposed to that virus. Others are in general circulation. So that's all I can say at the moment with that, but I can follow up with some more specific information. The British Society of Immunology is like an independent group. They have some brilliant experts, and they've got a task force on COVID vaccines on their webpage. So I'll try and post the link in the chat. So they have some really great resources that might be of interest to you.
Another question is, do you have to leave a specific timing gap between the vaccine and the other vaccines? So for example, whooping cough and the flu vaccine, and then the COVID vaccine, do they have to have gaps in between them?
No, you can have them at the same time. So it doesn't really cause any problems. There is no interactions between them. The only gaps and the time that you need to consider is between each dose of the COVID vaccination, which is, Augie has already mentioned, is 8 weeks from the first to the second dose and 3 months between the second dose to the booster dose. Those are the only timelines that you need to consider.
Yeah, I mean, when we first vaccinated, we did say 7 days between other vaccines and the COVID vaccine. With the booster campaign, because we did booster and flu at the same time, the JVCI adjusted and said, actually, you can give it at the same time. And vast majority of people tolerated that, no problems. Some people prefer to wait a week between doses, that's fine, but it is safe to have them together if you wish.
Are pregnant women more likely to suffer side effects after a vaccination compared to non-pregnant people?
Interesting. Not that I, yeah, it's very interesting. Not that I have heard, Augie. I don't know if you know.
Yeah, no, I mean, I think I mentioned the slightly immunosuppressed state a pregnant woman's in, just to be able to facilitate carrying and carrying baby through to term. So whether that potentially predisposes you slightly, but the vaccination can't give you COVID itself. So in that sense, no, but obviously it's stimulating your immune system and the immune response. So, but I've not seen particularly on my caseload and people I've talked to after vaccination, more pregnant women than other general population having side effects that are significant, no.
Do you have a vaccination within maternity units where pregnant women can receive these, or do they just go to their GP? So I know in the Homerton there was a special sort of section where we'd go to get our jabs, but do they also do that with the COVID vaccination, or do you go, I guess, to the general vaccination centres?
That's a really, really good question. And it depends on each maternity trust and what facilities they have. So most of them do provide the flu vaccine and the pertussis at the same time. And some of them do even have an on-site vaccination hub where you can get your COVID vaccination. So if it's not within the maternity, but it will be either within the on-site, or they will have clinics that are linked to them. So you should be able to get it from maternity services.
Yeah, I think there was a lot of effort put in to try to line that up to make it more convenient for women attending their antenatal clinics. But there's been so much availability and really a lot of emphasis put on making it convenient for people to access their vaccines. So many more pharmacists have been stood up. Your GP practices are usually working in hub sites, so something called local vaccination centres. So a few GP practices working together to produce it out of a local hub close to home. And lots of pop-up sites everywhere. So we've really worked hard to make sure people can access the vaccine as easily as possible in as many different places that is convenient to them.
I know one of the questions was someone asked for a link to some sources of information, and I saw that you did post.
I'm going to post a few other ones, just trying to navigate things. Yeah, no problem.
Yeah, the person who asked for the link just explained that they'd read studies in the past that seemed to indicate that where there were specific antibodies are created, they target a particular disease, but lower the body's natural immunity against other diseases.
Not that I've seen. So studies in the past with specific antibodies against specific. So remember, we vaccinate against lots of infectious diseases. And obviously you can't protect against everything that's out there. And the key things like the public health messages of keeping well, eating well, eating your fresh fruits and vegetables, getting your exercise in, stopping smoking, minimizing alcohol, all those messages to keep you as healthy and well as possible, dealing with any long-term conditions as well. So we always, I'm a GP, prevention is better than cure. I like preventing stuff from getting more serious or preventing disease in the first place. And vaccination is such a powerful tool against that. So the idea that it lowers your body's natural immunity against other diseases doesn't sound physiological. I can't think in my head how that may work. Obviously, I'm not an immunologist, and I've posted a link to that immunological site that deals with COVID-19, immunity, the vaccines. So it may answer your question in a little bit more detail, and you may find some resources there that I hope are helpful.
Got to unmute myself. Someone mentioned they're 17 weeks pregnant. They've had their second dose of the vaccine in May, got pregnant in October and contracted COVID in October just before conceiving. They're due to have their booster, but they're hesitant to go ahead because they've heard different stories about the impact on the fetus. She has heard that the antibody attacks the fetus, i.e. an autoimmune condition.
Okay.
Yeah, carry on. You go first.
Okay. No, go ahead, Nina.
That's I think the simple that I can understand how anxious you can be by hearing all of these mixed messages, but to reassure you that as far as we know from the evidence that's present, that's not the case. So as long as you have had the time, the 28 days that we mentioned, you can have your booster and you shouldn't really have any antibodies because it's not a live vaccine. Yeah. I think it's always important to go back to that. It's not a live vaccine, therefore it can't give you the infection. And as such, as we have already mentioned, it can't cross the placenta, therefore it won't get into the baby's blood circulation, and as such, it can't impact the baby.
And antibody attacking the fetus in terms of autoimmune conditions. So there has been concern that there may be a flare of autoimmune conditions, because like I said, this is stimulating and enhancing and facilitating your immune response to do what it would normally do in response to an infection. But there hasn't been any long-term evidence that that's the case. The Rheumatological Society is looking into this. And in fact, they strongly recommend that their patients with long-term autoimmune conditions, because they tend to be treated with immunosuppressants that dampen your immunity and pose you at more risk from infection and complications from COVID. The strong recommendation is people with those conditions, please get your vaccine. So, and it's been shown to be safe to them. In fact, we're boosting them with a fourth dose because their immune response to the vaccine is tempered because of the medication they're on. So we've not seen any evidence that the antibody can attack the fetus or increase conditions or anything like that.
Another question about antibodies. The person has concern about antibody dependent enhancement, as they'd read a paper before the beginning of the pandemic that said it was a concern for immunologists, particularly with attempts to produce coronavirus vaccines.
Yeah, I think I saw something about this, and that whole thing of vaccination will, I think you mentioned it in your previous question, will somehow reduce your defenses. We haven't seen that. Categorically, the people who have been vaccinated, I had a 91-year-old that turned up positive on my list the other day. A COVID infection in January 2022 is not what it was in January 2021. And the difference between that year is the fact that we've vaccinated a large majority of our population. So people it's shown it protects them against severe illness. So yes, she popped up on my positive COVID list because she was 91. We obviously gave her a call, but she was like, oh no, I'm fine. I tested it because my grandson got it, but I feel completely fine. That may not have been the case a year ago. In fact, my care home residents from April 2020 had a very different story to tell. So from what I've seen, just in terms of my own practice, it has not increased the chance of other infections. It has not increased the chance of less ability to fight, anything else that's going on. It has protected people from infection and from severe illness and complications. But that immunology side, I hope, is helpful for you.
Then there's a question, do you think a baby's immune system is strong enough to deal with antibodies?
So a baby's immune system, so a newborn baby, so you would have already transferred lots of antibodies to that baby during pregnancy. That's what happens. So you, as an adult woman carrying a baby, there's that transfer going on all the time. The whooping cough vaccination that we now give to pregnant women, the idea of that is that we want those antibodies to flow through to baby to protect baby itself from whooping cough infection, especially in the first 2 months before baby gets their own vaccines and forms their own antibodies. But in that first 5-6 years of life, we all know that when we send our kids to nursery, that perpetual runny nose and cold that happens, that's their immune systems being exposed to all the bugs and viruses out there and producing antibodies and getting ready for, ongoing childhood and adult life. So by the time you're an adult, you've amassed lots of protection from lots of various diseases. So that's why there's certain infectious conditions we see commonly in children, and there are others we see in teenagers, others we may see more in adults or less commonly. So definitely babies, it's part of the immune system's job to produce antibodies, and it's doing that all the time as it's exposed to things in the general atmosphere. So all the vaccine is doing is enhancing and boosting that normal response that our bodies already do.
And I think if I may add, and that might be something important to note as well, if you're breastfeeding, it's still safe to have the vaccine, because as we have alluded to earlier, through breast milk, you will pass on some of the immunity to your baby to strengthen the immune system during those early 8 weeks of life in particular. And by doing so, they will get you will provide a passive immunity to your baby. So breastfeeding itself shouldn't stop. And if that's something that you are considering, you don't need to worry about it, and you can continue with breastfeeding your baby as well.
Someone raised a concern about the effect the vaccine will have on the baby in the long run. So in terms of the child's growth, development, has this been talked about?
Good question, and it's a common concern because we don't have 5-year data and 10-year data and 15-year data like we have for some other vaccines. We don't, because but we have to think about what we've seen already. We have to think about the fact that we're 2 years into a global pandemic that has affected and disrupted life in so many ways. We have to think about the alternative to let this virus run riot with the risk of complication, death, and ongoing problems. Remember, we had the flu pandemic. Well, we don't remember because none of us were here, but 1918 was the flu pandemic, Spanish flu. They estimated 60 to 100 million people died. To be able to live and thrive, you need to be around. So far, the COVID-19 infection has killed 5.5 million, they believe, globally. Vaccination has definitely tempered that, What was the alternative? So the vaccines were produced, and we have the benefit of modern science and innovation that it was produced. We have the precedence of we've used vaccines for a long time. The technology, the mRNA technology, has been used in Ebola vaccine development and cancer treatment. So even though it's new specifically to this vaccine and the vaccine is new, it is technology that has been used for a while. They had lots of collaboration, lots of funding, wonderful what happens when people work together. And they had to come up with a solution for something that was a major problem for the world that stopped all of us in our tracks. And that's why they approved the vaccines as quick as they were able to. And now we've had over a year of vaccination, and there's so much scrutiny and oversight, and all of that information will go on being followed up. But we have precedents from other vaccination programs, other precedents from what we've done in terms of the fight against pandemics and infectious diseases. And there is no reason to believe there will be long-term adverse effects to 5 years, 10 years. Obviously, we don't have a glass ball. I can't tell you we have that information now, but all signs are that the benefits of the vaccine far in protecting you against COVID-19 and the chance of severe complications or even death far, far outweigh any potential risks. That's what we know right now and why it's so strongly recommended.
Then another question, if breastfeeding will pass on the antibodies to the child anyway, is there any harm in waiting till after the birth to get the booster?
It's an interesting question. From what we know, as we have said, even if you have the two vaccines and the booster used, it doesn't protect you 100%, as we have said, and you may be likely to contract the COVID-19 infection. From the data that we have is that those mothers who haven't had the vaccine at all, or who have had a complete dose of it, are running a higher risk of getting pregnancy complications. So for that reason, I wouldn't recommend, from the data and the evidence we have, to wait, because you will want to get the benefit to make sure you have a healthy pregnancy, healthy outcome, and in order to be able to continue looking after yourself and the baby afterwards. And I don't know, Olga, if you want to add anything.
Yeah, I just want to add, depending on when you got your first two vaccines, we know that the reason the booster campaign was recommended is that we know those antibodies wane after 6 months in particular. And against Omicron, the 2 doses is just not enough protection. We know that categorically. So hence why we recommended the 3rd dose or booster dose. And remember, we have precedent for that. I had to get hepatitis B before I could start as even a medical student. And that needed 3 doses over a few months, of course. And every few years, I get a blood test to check, are my antibody levels high enough? It may be maintained. And if they're not, I need a booster. We may get there with COVID, we're not there yet. But at the moment, we know from what was shown last year that those antibodies wane after those first 2 doses, and it's definitely not enough protection against the Omicron variant, that is the predominant variant. So our recommendation would be to get the booster before birth, because if you're looking to pass on any antibodies for any possible protection, you're more likely to have them after you get the booster.
Someone's mentioned that they've had COVID twice during pregnancy, and they're not yet vaccinated, but they're considering getting the first vaccine. And they're asking, will it help them? They'll be about 36 weeks pregnant, they think, by the time it's effective. So will it help if they get the vaccine, their first sort of dose of vaccine now?
I think it definitely does. As we have said, your own body's immunity may vary to the immunity that the vaccine provides, and also the immunity from having contracted the infection, and whether it's been by the vaccine goes down after a while. So it's you still can have it, and that's the current recommendations.
Yeah, so it takes about, they say about, I think 10 to 14 days for you to build up, have that immune response. So you are still technically in term, even though we know anything may happen after 37 weeks. But so it is still recommended for you to go ahead and get that first vaccine as soon as you can.
So there's still like benefit to be had, even if you haven't had the second dose, you're still getting some protection.
Because think about the postnatal period as well. So it'll protect you for that period. You don't want to necessarily be exposed or be more at risk at that point too. So yeah.
So someone just wanted to clarify something. So I'll just read what they've written, just so then you can clarify if they've understood correctly. So just to clarify, based on the last response, it's probably one of your early responses, but is the flu jab not an mRNA vaccine, or not the same type of vaccine as the COVID jab? So first dealing with that.
So the flu jab, I'm trying to think now, people are really testing me here. I'm just trying to think what type of vaccine. The mRNA vaccine is a specific type of vaccine that is unique at the moment to the Pfizer and the Moderna. So we've not had other vaccines similar to that in wide circulation. So the flu vaccine is like a modified, it's not a live vaccine. I think it's a modified particle of the flu, added onto an adjunct that then goes in and stimulates your immune system accordingly. Similar to how the AstraZeneca vaccine is. So it's a modified adenovirus vector that has the spike protein of the coronavirus on the edge, so it can stimulate your immune response. So it's quite a lot of mechanics of how vaccines work, but the basic premise is that it wants to almost trick your body into believing it's met the actual infection, but it's not the full infection. So it can't cause the big infection or severe infection. So that's where people may get a few side effects or may still contract the infection later on, but then you have the antibodies ready to recognize and act quicker and accordingly to neutralize it.
Okay. Is the booster the same as the first 2 shots? And then there's a follow-up bit, but I'll ask you once you've answered that.
Yeah, so at the moment, for pregnant women and for anyone under 40, we're recommending Moderna or Pfizer, and as for the first 2 vaccines. And then the third booster dose for everybody has been recommended the Pfizer and Moderna. Because again, when JVCI recommended the booster program last September, they thought that those vaccines had slightly better outcomes and were safe and effective. And for simplicity as well, it was thought, let's offer that to everyone. If you're going for a vaccine now and it's your first dose, just practically speaking, there's not much AstraZeneca in circulation. So you're more likely to come across Pfizer or Moderna. But that would be what would be offered to you as a pregnant person or if you're under 40 years anyway.
So the person who's asking about the specifics of the shots is saying, so if the booster is the same as the first 2 shots, she's written, I assume it has no greater ability to protect against Omicron. It's just that it tops up the antibodies from jab 1 and 2, which taper off after a few months. So I think she wants to check, is that correct?
So it's a good question. So they've not changed the framework of the vaccine, and whether that will change for any future campaigns that we may be involved in, we'll wait to hear as more data emerges as the year progresses. So the actual vaccine itself is exactly the same one we were given back in December 2020. They've not changed that. And by topping up your antibody, you are protected more, though. That's the only thing I'll add to that.
The lady who had said that she'd had contracted COVID twice and was wondering about getting her first jab quite late into the pregnancy. She's just added that she was worried about contracting COVID whilst pregnant, and that her midwife services had reassured her there was no data that the infection will pass the placenta to the baby. So again, you might want to just reiterate. I know you.
Yeah. I think that's the same with any infection or illness you may have during pregnancy. Exactly.
Yep.
And then someone's asking, I had both Astra doses before I conceived. Is it a problem to get the Pfizer booster this time in terms of the difference of the vaccines and the body's reaction to the vaccine?
So no, it shouldn't be. We have seen, we've now vaccinated lots of people with the booster. Lots of people had Astra, the first 2 doses, and the recommendation, like I said, was for everyone to get Pfizer or Moderna for the booster dose. And so we've not seen any adverse outcome. And yeah, we would say proceed and get your booster dose as soon as you can.
I think just to add to that, because there has been some studies in the press, and you have heard that those who had some the AstraZeneca had a very rare condition in terms of getting blood clots, so they were recommended to have the Moderna and Pfizer. So it's absolutely fine.
Okay. I think that's the last question, so I'm just going to sort of check if there's anything, Nina and Ogi, if there's anything you want to sort of add or reiterate from what you've said before. It's a really helpful session, lots of really practical questions, so there's really useful information there.
I think from my perspective, if I may go first, Ogi, is that the key messages here are that it is safe to have it during pregnancy. You can have it at any time, but given that we will recommend 3 doses, we will, if you are considering having it, please have it early. As we have already said, you can have the 8 weeks between the first dose and the second dose, and 3 months between the second dose and the booster. And it's not a live vaccine, so you will not pass the infection, or you won't actually get an infection as a result of it, and you won't pass that to the baby. You don't need to stop breastfeeding because the baby will get the passive immunity. And if you have, and your chances of getting COVID infection in general is not increased just because you're pregnant. Your chances are like any other adult in England. What we know, if you are pregnant, you will develop severe illnesses, and that's the reason why we recommend to have it in pregnancy. And there are some women who fall into what we will call of a high risk pregnancy, and we would recommend for those group of women to particularly consider it. And those women are, as we have mentioned, if you have high blood pressure, if you have heart conditions, if you have asthma and any immune problems, and if you are overweight, if you are over 30, age of 35, so particularly, or from a particular Asian minority and ethnic background, you should definitely consider having it, because we know that those mothers who have contracted COVID-19 vaccine has had a severe outcome as a result of it.
I would just add that it's been such a tough time for everyone the last 2 years, and it's particularly anxious when you're planning a pregnancy or pregnant, and it can be such a vulnerable time. And with the lockdown and separation from family, that's just added to the stressors. So I'd say that these decisions about anything, pregnant women are always so careful about anything that goes in their bodies, anything they eat, you know. So this is another, and I'm just, thank you for your engagement. Thank you for the brilliant questions. I think they were great today. And I would just really encourage everyone to weigh up the information, really critically weigh up. There's a lot of stuff out there that is frankly dangerous, you know, telling on truth. So I'd say always look for information from reputable sources, from the opposite side of what you're thinking, you know, if you're not sure about the vaccine, to just weigh things up in as balanced a way as possible. Seek out your trusted healthcare professionals. So that's your midwife, your GP, you know, we are here to talk to you. I know access can be difficult at times, but if you send in those online consultations or send in an email, most of us are here. We won't judge you, you know, we won't, you know, look at you in any way. It is about providing information in as open way as possible to address any of the real concerns that people have out there, because it's been such a scary time. But I wish you all the best for those that are pregnant, those planning pregnancies, and thank you for all the work Maternity in Action does. I think you guys do a brilliant job supporting women, and thank you for having me.
Well, thank you both. Really appreciate it, both Nina and Ogi, for all your time and for answering all these questions. Just want to also say thanks to the Mayor of London Office of Health and Improvement and Disparities, sorry, the Association of Directors of Public Health and NHS England London region for working with us on this webinar. Thanks to Lisa and Michaela, who worked behind the scenes to make this happen and ensured it ran so smoothly. We will send a link to the webinar recording to everyone who registered. We also encourage everyone to get involved in Maternity Action's campaigns by signing up to our e-bulletin and following us in social media, and also to check out our website, which is a source of really useful information. So yeah, thank you everyone. Thank you very much for the wonderful questions as well. It's good engagement.
Thank you.
I think that's it.